And we are back now with a health alert about ADHD. There has been a surge of adults being diagnosed and at the same time an uptick of social media posts driving attention to symptoms. So could you have ADHD and not know it? Our medical correspondent Dr. Darian Sutton joins us with what you need to know. Dr. Sutton, I see a lot of this online, and the question I guess is, what is real or legitimate ADHD versus just feeling anxious? Why are we seeing more adults, and is it something we develop?
You know, I see it as well when I'm online and scrolling, and sometimes even as a physician, I'm like, do I?
Right.
Doctor? And I understand that, and I think that the difference is that we can all be distracted, we can all lose our attention, but when that is chronic and consistent and affecting your daily life, that's when it becomes a problem. And it's more common, as you said, than people expect. The CDC estimates that 15.5 million adults are living with this condition. The majority of adults are diagnosed in their adulthood. Reasons behind this, social media being one of them, more access to telehealth, diagnosis, and treatment. But I think understanding the symptoms are so important, and we have them up here. Difficulty completing lengthy tasks. What does that look like? We often talk about kids getting dressed in the morning, doing their homework, but for adults, that can look like doing your taxes, organizing the files, the sequential steps, and having executive dysfunction, which is when you know you need to do something, but once you sit down, you just simply can't do it. There's also a factor here of disorganization, and I have to say, there's this concept that people with ADHD are often sloppy, but that's not the case often. It's usually a concept of perfectionism, where you want to be perfect and you fear making mistakes, and that leads you to have disorganized thoughts and not being able to complete it. And of course, that can affect your diet as well as your relationships inside and outside of work.
I loved how you said, I was wondering if I should go to see my doctor. So what kind of doctor do you need to see for a diagnosis like this? What are the resources out there?
Yeah. Well, number one, you can talk to your primary care provider. They can often at least help you with the very beginning steps of getting that appropriate diagnosis, and knowing that a psychologist, a psychiatrist, mental health providers can also help you get to that diagnosis. And then knowing about the opportunities for resources. The CDC has an ADHD partner toolkit, and there's also an organization and others like it called CHADD, for example. It stands for Children and Adults with ADHD. This provides resources, advocacy, and education.
So what are some of the ways that you can manage it, both at home and with the help of a doctor?
Yeah, well, those with minor symptoms, or maybe they may not feel like they need attention or assistance or a treatment specifically, you want to make sure that you manage your risk factors. Number one, sleep. We talk about this often, but that fatigue can increase distractibility and make it difficult to rein in those impulses that are telling you to do one thing or another. And then your diet, minimizing added sugars, going for whole foods because you want fuel to be stable and consistent. And then knowing that treatment isn't just stimulants. We talk a lot about stimulants, but it often includes training, education, cognitive behavioral therapy, and then there are other medications that are not stimulants, and even in certain cases, antidepressants. But it has to start with a conversation with someone who is a professional and has a education background and training. It can't just be one of us scrolling on a phone diagnosing ourselves.
So not on TikTok.
Not on TikTok.
Okay, great. Yeah.
And that's someone who is avidly on TikTok.
On TikTok. Well, you're a content creator on TikTok.
Hopefully people learn something more.
Thank you, man. I think we all have.